flexors are, they actually go from this sticky outy bit of the leg bone here, and then actually cross the hip joint, and actually, as you can see, in a broad sense, that they actually go to the side and kind of the front of the spine. They actually attach to these little processes sticking out here on the spine. And they act to flex the hip, hence the name hip flexors. So to demonstrate what happens when those hip flexors get tight, so here's a pretty neutral pelvis and a fairly neutral spine. Two options here. When those hip flexors get shortened, they can either draw the pelvis forward like that. So think of someone, and I know you know somebody like this, who constantly walks around with, it seems like their butt's sticking out or their back is really arched. That's one of the reasons why. Alternatively, the pelvis can stay fairly neutral, but then the low back gets pulled down and forward, and again puts a lot of compression into the low back from behind and on those vertebrae. So both kind of owie, owie, owie eventually, and if we create some more space and room, that back is so much happier, and the pelvis can also return to neutral too. And that means that you feel a lot better. And most people sit a lot for work, and so we're, as a society, in the state of constant hip flexion, and that creates a big problem because when you go to stand up, you've been in this shortened state for a really long time, and then you go to stand up and oh my gosh, that's a really big stretch, and your body has to try to accommodate that. So if we open up all of this area and get these hip flexors a little bit freer, then that means you ultimately feel a lot more relief and feel a lot better in your low back.